The part of the brain that deals with pleasure is in the ultimate place of control in the brain.
There's so many different responses and reactions to different alcohol and drugs.
So the opioid binds, it triggers downstream effects that release dopamine. They also bind in the part of the brain that says, hey buddy, breathe.
Hi everyone, this is Gary Blackford, and you're listening to the Hope Within Reach podcast. Here we're helping people understand addiction all through a biblical lens. So if you want to understand what's really happening and what to do next, give us a listen. Hi, welcome to the Hope Within Reach podcast. I'm Gary Blackford, and it's so good to have you join us today. If you like what you hear on this episode, please comment, or even subscribe to this podcast so you can hear future episodes. Today, I have the privilege of introducing Dr. Holly Geyer with Mayo Clinic. Dr. Geyer is an addiction specialist, internal medicine specialist, but most importantly, she's a great friend. Her and her husband, David, are great friends. We've known them for several years. Love all that she does, love who she is. Holly, welcome to the episode.
Gary, it is a pleasure to be here today, and the hat I get to wear is president of the Arizona Society of Addiction Medicine. What we're going to be talking about is all the principles that our society and our field employs as we talk about addiction.
Yeah, that's great. And just for our viewers, if I read the list of Holly's accolades and what she's involved in and everything that she's doing, that would take up 3 episodes of this podcast. So we won't do that. So we'll just get right into the questions with Dr. Geyer. So Holly, I'm going to jump right into the misconceptions around addiction. And as an addiction medicine specialist, what are some of the most significant misconceptions that you've seen in the public, maybe in the church, just in general? What are some of the misconceptions you've seen in addiction?
Oh, Gary, I could spend an hour and a half with you just talking about all the misconceptions in themselves. Some of the biggest ones that we've had historically is what drives addiction. And I speak to various populations on this. What is that initial driver for it? When I speak with people in that social world, oftentimes they say, listen, Dr. Geyer, I'm in the social service field. I'm a social worker. If we could just fix social determinants of health, if it was food security or housing or better environmental living conditions, we could fix addiction. Drivers, probably natural outworkings of addiction, absolutely, but not addiction. Gary, like yourself, I speak with people in the pastoral world and I ask them that question, and the response is often, listen, we see, the driver of addiction, true addiction, as a sin disorder, as nothing more than just a lack of connectivity to God or a lack of purpose. And if we could fix just that, addiction would go away. Natural drivers to the condition, absolutely. Outworkings of it, absolutely. Addiction itself, I would make the argument no. And same goes for the psychological field. In fact, that tends to be what we go to as society to say, what is addiction? Nothing more than a mental health disorder, right? A problem with depression or anxiety or PTSD. You fix those things, addiction goes away. Drivers, absolutely. Outworking of a condition, absolutely, but not addiction. Well, Gary, we're left with one category, and that's biology. And I'll tell you, for the last 20, 25 years, the science that's come out about addiction proper, the rewiring of the brain, all the change in the neurotransmitters and how that brain communicates has been staggering. In fact, some of our best knowledge has come from animals. Yes, your cat, your dog, and your pet rat can all get addicted. And so I would make the argument that addiction proper is truly a brain rewiring problem. But the substance use disorder category is very different, and that's where everything comes together from all those other domains.
Dr. Geyer, I absolutely agree with you. I think up until recently, we really didn't know what was happening biologically in the brain and what people were actually going through physically as their neuroplasty and synapses and all the chemicals, dopamine, serotonin, all the changes that happen in the brain. So just in general, for our viewers today, and I know we're not going to get into the deep levels of this, but just in general, what happens when somebody all of a sudden is now formally addicted? What does the brain look like?
Gary, in one line, the brain has been shortcutted.
Mm.
The brain is the most complex organ in our body, and it's got 7-lane freeways going in one direction and dirt bike paths going in another. It is highly compartmentalized. In the setting of addiction, the part of the brain that deals with pleasure, our euphoria, right? What you feel when you eat ice cream or hug your kids, is in the ultimate place of control over all other forms of control in the brain, including that frontal lobe, our executive decision center, where we say go, no go. The brain is constantly under a sense of pressure to go in a direction where euphoria, pleasure, or that next high is being sought in early stages. And then compulsion sets in and rewiring sets in so that you can't even navigate your way out of your problem.
Mm, mm. And that's where dopamine comes in, to your point, and all of the chemicals that make an impact, and the whole unbalance, right, of pleasure, pain, and what happens there in the brain, for sure. So I love the shortcutting. Obviously we're a faith-based podcast, and we believe in Jesus Christ and who he is and all that he does. But the one thing I would say is what fascinates me about science and talking about the brain is our God created it. And we know our God created it. And so what fascinates me is, man, what an organ that God would create our mind with so many pathways, so many different highways, to use your term. And the fact that addiction disrupts that, disorients that, destroys that, it sounds like the enemy of our souls.
Oh, Gary, it's so well put. In fact, there's no other organ in our body that can handle the extremes that the brain goes through. Where we hug our pets or go for a walk, we get maybe a 50 to 100% increase in the normal amount of dopamine we make. And drugs like amphetamine routinely go up 1,000% our natural
Mm.
output. Opioids, 300-400%. Now imagine doing that hours after hours, day after day, year after year.
Yeah.
The heart, right? Target a heart rate of maybe 85%, your maximum when you go to the gym for 60 minutes. That's therapeutic. What
Yeah.
happens if you target 1,000% increase in your heart rate? It's going to explode unmentionables on your ceiling, right?
Absolutely.
But the brain adapts. It's
Yeah.
amazing.
Yeah, no, it definitely is an amazing organ, and our God's an amazing creator. There's no doubt. All right, so I'm going to step back a little bit on affecting the brain. So how do opioids actually affect the brain, and why do they gain such a powerful influence? I mean, obviously you explained a little bit about the pleasure area and it kind of overriding everything else, but how do opioids affect the brain?
Great question. I get this one all the time, Gary. And one of the most important things to understand is that for anything you put in your body, if it's going to have an impact, it likely has to have a receptor for it, something that triggers the next signaling cascade in the body to do something else. We have opioid receptors all over our bodies, not just in our brains. And those receptors are there to carry a signaling cascade. So for the receptors in the periphery of our body, our arms, our legs, the point is to modulate pain, right? To shut down pain sequencing. Opioids will bind the receptor, send up a signaling pathway that shuts down activation downstream of that signal. In the brain, when opioids bind, they also bind not just to receptors that modulate pain, but they bind to an area called the nucleus accumbens. That's in your limbic system, your pleasure center. And when they bind there, in some individuals, you can experience a sense of euphoria or a sense of pleasure. That's what happens when dopamine is released. So the opioid binds, it triggers downstream effects that release dopamine. Now, the problem with opioids is not only do they bind in that part of the brain, but they also bind in the part of the brain that says, hey, buddy, breathe.
Yeah.
And with higher and higher doses, you do less and less breathing unless you've built up tolerance. So not everyone gets this, Gary. Some people can take the drug once or twice, they throw up for an hour and they're like, I'm never going to use it again. And the next person will take it and say, that's the best high I've experienced in my life. And I wasn't depressed for the first 45 minutes in 2 years.
Yeah, you bring up a very, very interesting point. I want to go down this road a little bit for our viewers because we get asked often about this as well. Why? So obviously you're a physician. Why does addiction to some drugs or alcohol influence some people in one way and other people in other ways, or some don't even seem like they can ever be addicted? It's like, so when I was in the Marine Corps, I had buddies that would drink 5, 6 beers a night, and you would never know they had a problem. They were doing everything in the Marines I was doing. They were all the exercises, all the training, everything we did. You'd never know it. They never acted drunk. They never. It was great. And yet I had other buddies, same unit. I had other people in the Marine Corps who would have those 5 or 6 beers, and the next thing you know, they're acting crazy and drunk and everything else. So why is that? Is there really an individual response to alcohol or drugs, and is it really by individual?
Boy, you are asking the question on every addictionologist's mind in America. We would love to know that. And I'll tell you, we're asking the same question about heart disease and cancer and other conditions where some person seems to get 3, 4, 5 versions of the same kind of disorder in the same organ line, and the guy next to him, even a first-degree relative, gets nothing. We don't know, Gary.
Mm.
Our society has recognized that upwards of 50% of cases seem to have a familial or a genetic component. And maybe this has something to do with the processing or the metabolism of things in the brain, right? Maybe neurotransmitters. Maybe it has something to do with the way we're naturally wired to begin with. There's probably a host of different things that contribute to this. And I can tell you, even with the advances we've seen in artificial intelligence, our prognostic calculators for this are dismal and miserable. We've got a long way to go.
Yeah, it's interesting. It's a very very interesting question when you think about it, because we've seen it. We've all seen it. I'm sure you've seen it, obviously, at Mayo, but there's so many different responses and reactions to different alcohol and drugs that individuals have. Now, that all being said, I think a lot of people will be in denial, right? That they may not be acting out with addictive behaviors and such, but obviously they're addicted, and they're definitely they can't go without, right? The alcohol or drugs or coffee or or food or anything else that could be addictive, right? Hey, listen, I admit coffee is a problem. Anyways, we won't go there. So let's talk overdose a little bit. What happens in the brain during an actual overdose, and why is this so dangerous?
Well, it depends on what drug we're talking about, Gary. So if we're on the topic of opioids today, that's an easy one. An overdose to an opioid is a situation where a part of the brain that says, hey, buddy, breathe, is no longer functional. Now, what you'll see in the first couple of minutes of use to the drug is that that person may become more drowsy, more sleepy, less responsive. And then over time, their respiratory rate will drop. Our governing number is around 7 to 8 breaths per minute. You're probably in an overdose. The pupils get smaller, and that person is on their way to a state of being completely unconscious and cardiovascular failure. When a person is on their way to that state of not breathing, the average response time is 3 to 5 minutes. They are about to die. And this is why it is so key to have overdose reversal medications widely endemic in our community. There's a drug out there called naloxone. Some people know it as Narcan. There's many other trade names. You give that drug, and by the way, 95% of people who don't know how to use the little intranasal version give the drug correctly,
Yeah.
even if they don't know what they're doing. You deliver that drug and you're going to get a pretty quick response in most people within 1 to 2 minutes. It is temporary. It'll buy you maybe 10, 15 minutes in the era of fentanyl, maybe longer if it's a prescription opioid. You got to call 911, Gary.
Yeah.
They're in a relapse.
Yeah, so let me again pause here for our viewers. If you have a loved one or a friend that you know is active in addiction, that you know is struggling in some form of addiction, it would behoove you to have Narcan on you at all times. It would behoove you to have Narcan or naloxone, as Dr. Geyer said, in within arm's reach in the house, the apartment, wherever you're at with this individual, because it could save their life. Absolutely save their life. All right, so Dr. Geyer, I'm going to shift gears a little bit, and we're going to talk a little bit about the elephant in the room, and that is addiction a sin or is addiction a disease? Now, we're coming at it from a faith-based perspective, a biblical worldview, and so I can tell you, and I'll share with the viewers, and I think pretty much all our viewers would know, we look at addiction as both a sin and can be a disease as well. Obviously, sin is the nature that we've fallen into thanks to Adam and Eve and everything that happened at the fall of man. And so we're all born into a sinful nature according to the Bible. And so with that, we make bad choices. We make sinful choices that end up disrupting us. But we've also known, based on latest research that you've already mentioned, we know that there are physical changes that happen in the brain as a result of long-term use of these, any of these substances, alcohol or whatever. So from your perspective, sin, disease, why does that matter? Does it even matter? The other thing I'll tell people is, listen, I get why you're asking the question, but in reality, in my view, Jesus Christ came to forgive sins and he came to heal diseases. So I don't care what you call it. I know who the answer is, and he'll take care of either one. So, but in your perspective, sin or disease, what have you seen?
Boy, I get this question all the time, Gary, and I do believe it's an important one. One of the first things I would say is I think that our industry, the addiction industry, has done society a disservice by making the terms substance use disorder synonymous with the word addiction. When we start using them interchangeably, what we're doing is taking something that's a long process for the average person, a road, and making it synonymous with advanced biological changes in the brain. Across America right now, there are labs, or right now, rats in lab cages dying across America as they seek out consumption of cocaine day in and day out. They're going to die of starvation. There's a pile of food in the corner, and they're not going to go to it because they would prefer the cocaine. Their brains show the exact same changes that we see in humans in advanced addiction. But I want to share a slide with our audience here because I think this one is important.
Sure.
This slide is an evaluation of exactly what's happening in the cascade of early substance use disorder over to advanced substance use disorder. And to offer this as more of a verbal graphic to our audience, if you were to take a sheet of paper and keep it white on one side and then keep coloring it more and more red as you go to the right-hand side, what you would create is the cascade or the change over time from early substance use disorder over to advanced substance use disorder. Now, in my field, we call it mild, moderate to severe substance use disorder. And we use something called DSM-5 grading or scoring to determine what level you're at. All of these are manifestations of behaviors, with the exception of two criteria that we use called tolerance and withdrawal. The rest of these are, how do you behave? Well, I think most of our audience would agree here that most people would agree behavior is not necessarily biology, right?
Right.
You can have very different types of biology going on, and they're going to not necessarily manifest in the same types of behaviors. Over time, with more and more exposure to a substance of a use, the brain continues to remodel to a point where I believe we should be employing that term addiction. Addiction referencing the major changes in the brain that keeps that person trapped. Now, early in substance use disorders, that brain is not remodeled. And this is where we're seeing the behaviors, the decisions, right? In some cases, the
Right.
sin.
Right.
Recreational use, right? Not listening to mom and dad where they said, don't go out and party on Friday night. And the kid slams the door and races out and says, the heck with you, I'm going out with my friends. And they have a
Right.
6-pack. Well, that's not addiction. But maybe by month number 3, probably by month number 6, that repetitive behavior, that brain is remodeling. And that person's ability to control their decisions over and over becomes less and less as that brain starts to adapt and then make that pleasure center the go-to center for all decision making. Same thing for the pathway of chronic exposure here, Gary. People who use our opioids from doctors like perhaps me, who throw it at them without any pre-screening and give refill after refill. Over time, that person may never once experience euphoria, experience a high, right? They're not, as we would call, sinning, right? They're using opioids because I told
Right.
them to. But that brain is remodeling. And with recurrent use, there's going to be a day over weeks to months, and in many cases, years, where if we were to pull back that drug and say, you know what, it's not time, let's start to taper, these behaviors start to manifest. Those
Yeah.
behaviors are what we would entitle addiction. Same thing for chemical coping, where people use those drugs for mental health alleviation. It's probably a really bad idea,
Yeah.
but they probably work temporarily. And then day after day, week after week, the brain remodels, and then it's addiction.
Yeah. Yeah. No, it's a great slide and a great explanation. Thank you for sharing that. As I think about this slide and I think about your approach or your explanation, it reminds me of heart disease. It's the same thing when we think about heart disease. When Christians have a hard time saying that addiction is a disease, I always say, well, what about heart disease? And the fact that heart disease is mainly behavior driven up front. And that over time, if you don't eat right and you don't exercise and you don't manage the stress, you don't get enough sleep, all the physical behaviors, if you don't do those well, you'll end up with heart disease or some form of heart disease. And we have no problem as Christians saying it's heart disease, but for some reason, when it has to deal with the brain, we have a problem saying it's a disease with addiction. And so just a counterpoint for the viewers there. Any final thoughts on that subject, on that thought?
Oh, Gary, 50 to 60% of all American chronic diseases are driven by decisions, by mitigatable lifestyle changes that we could have
Yeah.
done as society, as individuals. And you're right. I'm a hospitalist too, Gary. I'll walk into hospitalist rooms where someone's been diagnosed with cancer, colon cancer, because they didn't eat right for 20 years, maybe.
Yeah.
And there's a room full of people and balloons and, their hands are being held and they're going to pray them through this. And then I'll walk down the hall. The next to my patient is someone struggling with addiction and that room is empty and
Yeah.
that person is alone.
Yeah. I mean, how sad. I mean, even though, yes, sin is a part of life, we know that. And if you're a believer, obviously you have forgiveness of sins and Christ has transformed us. But that's when the people need it most is, hey, let's be with these folks, whether they're in addiction, whatever it is, let's be with them. So let me jump to stress and trauma. So stress and trauma play major roles, obviously, in addiction. How do these experiences disrupt the brain's reward system? So, what have you seen physically with stress and trauma? One of the things we've seen at Adult and Teen Challenge is much of the problem or underlying root cause of people coming in our programs the last 10 years has been trauma based. There's been a lot of abuse, sexual abuse, physical abuse, verbal abuse, and it's really taken its toll. So what do stress and trauma do as it relates to the impact with addiction?
Boy, Gary, great question here. And one word of caution I would offer on behalf of the perspectives within Teen Challenge is what we would call a sampling error. Because individuals that are going to come into a long-term residential treatment program have either huge, long-standing addiction problems or failed out of other treatment programs or something so life-controlling they can no longer function in society.
Yeah,
For that
great point.
population, you're absolutely right. Trauma tends to play a tremendous role, and its impact on the brain, especially before age 18, if that's when it was induced, is huge. We know that most people who develop long-term addiction started before the age of 18. And why would you start before the age of 18? The data shows nationally it's not necessarily experimentation. It's escaping a horror one has experienced. And the dopamine system, the serotonin rest and relaxation system is traumatized. Neurotransmitters don't work the way they should, and the brain wiring system is hijacked. This makes it all the easier to alleviate one's problems with drugs. Now, that's different than most people with addiction.
Right.
Most people out there, especially when we're talking about the opioid epidemic, in fact, 80% of all people start with us. People in the medical field who offer opioids don't screen, don't monitor, and over time, unregulated, develop addiction.
Yeah, no, it's great, great points. It's always good talking to you about this stuff for sure. I learn every time I talk to you, Holly. So let me shift gears a little bit because we've got people watching this podcast that a son or a daughter, a cousin, a friend, a congregation member, if you're a pastor or a worker, that they know somebody who's in it right now. who's really struggling, and maybe they're even falling into enablement or codependency. As a clinician who's obviously board certified in addiction, what would you say to these folks? What should be the initial steps they take to manage through this, to navigate the journey with their loved one? What should be the initial steps they take, and how to get through something like this?
Great question. One of the first things I would say is if you're thinking to yourself, I don't actually know someone who's struggling with addiction. Either you only have 4 friends, because 1 out of 5 people does
Yeah,
struggle
yeah.
eventually within their life expectancy. In fact, some studies suggest upwards of 50% of all people will struggle with some form of addiction during their life.
Mm,
Or option number 2 is you haven't recognized it. And Gary, I think number 1, the most important thing is to talk about the elephant in the room, right?
yeah.
If you know someone who's having problems with the 4 C's, problems with cravings, right? That person's thinking about the drug or the alcohol far too frequently, or problems with control. They can't stop, even when
Mm,
they want to stop, even when they're doing it in situations they know are inappropriate or dangerous. If they have compulsion, they keep going back to it despite life's consequences.
mm,
And if they have problem with consequences themselves, right? You're not making family engagements, or you're losing your job, or finances are starting to fall through the roof. You're breaking down relationships. Any one of those 4 should be a red flag. More
right.
than one, all the more reason to start navigating towards the solution. And I would say the solution is number 1, after you've called it what it is, getting support. Support is going to be a combination of things, and I am a huge fan of the biopsychosocial-spiritual treatment model. That means that you're not just targeting a disease, you're not just giving out medicines, which, by the way, I believe play an important role in many forms of addiction, but you're treating the whole person. I've got therapies, Gary, I can throw at people, and I can give them drugs, and I'll tell you what, I may make them abstinent for a period of time. I am not getting that person back.
Yeah.
I'm not making a loved one. I'm not restoring their relationship with God. I'm not helping them get a job. I'm not making them a citizen or a mom or a dad. You need to treat the whole person. And so this means employing a diverse group of people to assess. That's getting someone to do a formal diagnostic assessment. This can be counselors, or treatment programs often do it. Even the primary care providers in society are learning.
Mm,
And then once there is a diagnosis, navigating to a treatment environment, depending on the level, mild, moderate to severe, that meets the needs of that person comprehensively.
mm, yeah. Yeah. So absolutely. So once they've talked about it, they've gotten the treatment for those individuals. While they're waiting, while these family members are waiting, what else can they do? Because obviously they're stressing about their loved one. They're wondering are they ever going to come out of it? Are they, or maybe they're still in it and they haven't been able to get them to the treatment. What can they do physically? Or should they be taking care of themselves health wise? What are your thoughts there?
Boy, Gary, one of the hallmarks of addiction is the breakdown of boundaries, not just on the person who's using the substance, but in the families as well. And that's one of the strongest things they can do, is build healthy boundaries. There's great books out there. I believe Townsend has one called Boundaries Itself that does an amazing job outlining where you need to build thresholds in your own life so that people don't cross them, but you still maintain relationships.
Mm,
It's going to be hard. And the natural history of most addiction is a relapsing disorder, oftentimes because the brain hasn't sufficiently readjusted to living in a natural world without chemical coping mechanisms. And so as you're going through this brain change time frame, as that brain is learning to readapt and fix those neurotransmitters, recognize that you need to be a source of support, but also take care of yourself in the process. Protect your family, protect your finances, and do so, in my belief, as a family, as a community, with your pastoral family deeply engaged, because you're going to need to rely on someone for support as well.
What about those that maybe they don't even realize they're enabling or they're codependent? What does that mean? What does it mean to enable family member and to be codependent? And how do you respond, or how do you change those behaviors? Any thoughts on that?
Yeah, there's a lot of definitions out there, but to put most simplistically, the concept of being codependent is to allow or to perpetuate bad behaviors in another person. That means a good example, someone who's struggling with opioid use disorder, right? Now they're going to tell you that it was their broken leg 3 years ago and their doctor gave them oxycodone and it still hurts and they ran out early twice last month and you have taken them to 2 separate ERs to get refills. At home, they're lying on the couch for 6 to 8 hours a day during daytime hours. They've missed Johnny's baseball game. You're okay with that.
Hmm.
Um, Health and wellness is the theme of our day, Gary. And the reality is that disease pulls us in one direction, health and wellness pulls us in another, and it is absolutely imperative that people differentiate both. If you see your loved one and they say, I've got chronic pain syndrome, that's why I need X, Y, or Z, right? Or I'm not addicted and my behaviors are justified because it's how I want to live. But health and wellness says you should be getting exercise, eating 3 meals, going to a job. If there's a problem differentiating those two, then you might be part of that problem, right? Reset your mind, understand what normal is, and bring that person towards it. If they're not willing to go towards it voluntarily, it's time for an intervention.
Yeah. Yeah. And I think that's the hardest part. Most people feel like they can't cross that threshold into intervention, but you're so right. I mean, for those viewers that are listening right now, set your boundaries. And that is a great book. Holly mentioned John Townsend, Henry Cloud wrote the book Boundaries. It's a fantastic book. Set your boundaries. Take care of yourself. Understand what addiction is. Educate yourself. But when you've done all of that and the individual has still decided, hey, I'm going to do what I'm going to do, and this is who I am, and what I want to do, well, then it's time for an intervention, or it's time for stronger boundaries. And this is where the old adage, right, tough love comes in. That we just had Pastor Gary Wilkerson on an episode, and he was telling us about his son and how he and his wife Kelly had to make the decision to kick him out of the house and get him. He was homeless. So as parents, of course, you don't want to kick your son out of the house and have him be homeless. That must have been horrific for them, and it was. It was a very sad time, a sad season. Their son is now healed, sober, living for the Lord. I mean, he's doing a great ministry actually with Pastor Gary. So great stuff, great ending there. But the bottom line is they had to make the hard decision and set those hard boundaries. Now that's not everyone has to do that, but you may have to. And I think I want to be real. That's one of the things about this podcast is we want to be real with people and we want to be practical. Yes, we provide hope. There is hope within reach. His name is Jesus, by the way. That's the hope. But in light of that, addiction is real, and dealing with it is real, and it can be painful. It can be frustrating. And hopefully by watching episodes like this, we're providing a little hope along the way so that you can make the right decisions as you're navigating that journey with your loved ones. She has written the book, Ending the Crisis, and with Mayo Clinic, a bunch of other authors as well. But Dr. Geyer actually sent this book out with Mayo, and a fantastic book on opioid use disorder. But there's great steps in here on addiction in general, and great explanations on what happens in the brain, the science of the brain, the science of addiction, all of those elements. So I would highly encourage you to pick up this book. Dr. Geyer, thank you so much for joining us. Always a pleasure to speak with you.
Oh, pleasure to be here, Gary. Thanks for the invite.
Yes, absolutely. All right, folks. Thank you for joining the Hope Within Reach podcast. Again, if you've enjoyed this episode, like, comment, or even subscribe to this podcast. Thank you very much for joining. Thank you for watching the Hope Within Reach podcast today. If you like today's conversation, consider leaving a like, a comment, and a follow. Let's get the word out there. Hope is within reach.